Hello, thanks for listening to the Total Knee Tips and Pearls podcast. This is Adam Rosen, your host. I'm a fellowship-trained orthopedic surgeon who specializes in joint replacement. In these episodes, I'm going to share with you a lot of my tips and tricks and review classic articles and current implant designs. Thanks for tuning in, and on with the show. Hello and welcome back. This is Adam Rosen. You're listening to the Total Knee Tips and Pearls podcast. So in today's episode, kind of keeping on the theme from the last episode about, caring for patients in the office, this again is really leading up to when you're in practice. So, practice builders. One little caveat, which actually I wasn't really going to talk about in my little outline today, but again, a great practice builder. And something I actually learned from one of the surgeons that I trained with when I was in med school. And I'll admit that I don't do it as much anymore as I used to, but I did it all the time in the beginning was, have a list of your surgeries for tomorrow. And at the end of the office hours today or on your way home is just call those patients and say, hey, this is Dr. Rosen. Just calling to see, do you have any questions about your surgery tomorrow? 99% of the time, they're going to say no. They're going to be caught off guard that you called them. They're going to be extremely happy that you went out of the way to call them. And they're going to say, no, I'm just looking forward. And you say, great, don't eat or drink anything after midnight. Get a good night's rest. I'll see you tomorrow. That means so much to the patients, as well as, a great practice builder if you're new in the community. And it's going to put your patient's mind at ease because, having a good patient experience is really, really important to patients coming in the office. To be honest with you, we really see patients for the most part for a really small moment in time. They're in the office for a long period of time. They check in, they probably sit in x-ray, they're in the waiting area, they get roomed, they sit in the room waiting, maybe get their vitals signed. You kind of pop in, you talk to them, you examine them, you look at an x-ray, you make a diagnosis, and boom, you're out the door. But they're really there for a while. So you want to make sure that when they leave the office, they feel that you took the time to listen to them, but that they're leaving with a plan. And that's what the important part of this talk is going to be about, is making sure that your patients walk out with something and a plan, even in this digital age. I find a lot of times if you walk in and talk to a patient and you may give them a ton of information verbally, they walk out of that office and they go home and they talk to their friends and family members and spouses. And a lot of times, they'll say, well, what did the doctor do for you? Nothing. He didn't do anything and he didn't offer you anything. And you may have given them all these great ideas and things that they can do, but they left with really nothing. And they have this feeling like they went and it was kind of a waste of time. So it's really important to try to have something that you can give to the patient. So in the electronic medical record era, if you're doing stuff electronically and they're tied into that program, you might do this electronically so they can get it on their portal. I still like to do those particular things as far as patient information in handout form. I may tag it into the EMR, but I like all my patients to leave with something. It's easy if you're doing surgery because you've had them see your schedule and they actually have a surgical date, but still I give them information. But the most common thing that I give out, I have my knee pain worksheet, and it's really important to take the time and write things out in a form to save you time and energy. When you start writing the same thing over and over and over again, patients will ask you, can you write that down? So my knee pain form has a bunch of information on it. Number one is a straight leg raise exercise. So it gives a little outline on how to do it, how often to do it, and a little schematic on what it looks like. And I could review it with them in the office. And I have a little checkbox because most of the patients, I'm going to recommend that. I have a general exercise program like biking and walking and swimming and, times per week and days. And sometimes I'll check that. I have a little box on weight loss, which, for patients that were looking towards surgery, if they have a goal weight, I'll calculate the weight with them and mark it off and go, this is your goal weight that we're aiming for prior to surgery. And then I also have medications on there, specifically the over-the-counter. So, listed ibuprofen, Advil, Motrin, naproxen, Aleve, acetaminophen, Tylenol. And I have on there the options of the doses that they can take over the counter and I'll checkbox what I've recommended to them. So obviously not an anti-inflammatory if they're on an anticoagulant, but I find that this way you can tell them, and we really find, the use of those medications easy, and they're over the counter. So we assume patients understand it, but they will mess it up. They'll take an anti-inflammatory when they have kidney disease, and, they'll avoid Tylenol because they're on a blood thinner, and you're like, nope, it's supposed to be the opposite way around. Tylenol is the safe drug. But having a sheet which has all that on there, along with a list of all the other stuffs of icing and compressive wraps and braces, but this way you can circle stuff and they walk out with that form. I find that is key. I also have a form which I wrote personally. I don't like using the hospital form. It's too generic, and I update it every year, but it's my total knee packet. So it talks all about arthritis and what the treatments are as a review, and then what knee replacement is. And it goes through my protocol from before surgery to after surgery and the entire process. And I always have them, although I'll explain that to them and give them informed consent if we're talking about surgery in the office, but I'll say, go home and read this 2 or 3 times. If you have a spouse, significant other, when you walk in the door, they're going to ask you what the doctor said. I say, give this to them and say, he said you should read this. And this way they can read that, and then they can all be on the same page. But this way they've walked out with the information. They've not only heard it verbally, but they have it written down. I also have a healthy eating kind of worksheet. So, I've gone through a lot of nutritional healthy eating options, and I listed some websites that I like that I can give to patients when they're either dealing with weight issues, eating issues. They don't know what to eat or how to cook. But specifically when it comes to surgeries coming up, these are all, plant-based foods that are high in protein, alternatives to carbs and, processed foods, high fiber foods to prevent constipation. So definitely just gives them some different ideas on healthy eating options for breakfast, lunch, and dinner and snacks in the anticipation that surgery is coming up, and we want to make them as nutritionally optimized as possible. I also have a whole packet that I give out to patients that are struggling with weight because, if you tell someone, hey, listen, your BMI is 42, I can't operate on you, you're too heavy, you got to go lose weight. That doesn't really help them. They're not really sure. I'm sure that they've probably been trying that on their own for a while, but they haven't gotten anywhere, which is why they're still heavy. So by, offering them some semblance of some information, and I explained to them, I'm not a nutritionist, I'm not a metabolic doctor, but we deal with these patients. So I have a little list of the, top 10 things, use smaller plates, eat smaller portions, weigh yourself on a regular basis, try to exercise daily. And there's a whole list of these sort of like common scenario things, avoid sugary foods, avoid, sodas, simple things. But also I have a whole bunch of foods on there that are alternatives. So if you like to eat this, which we know is bad, here's an alternative. So I'm always big on don't eliminate, but substitute. Find a better substitute for something you enjoy eating, and look at portion control, and that may help. And then I refer them usually onto our metabolic clinic, and I say, hey, here's a plan, here's an idea. I need you to lose this much weight before you're a safe candidate for surgery, so we don't have a complication that we could have avoided. But in the meantime, here's some options, and then I'm going to send you to the experts. The other thing that I've actually just been working on, actually with a local apothecary, which is more into the naturopathic, homeopathic stuff, is that you will get a lot of patients that will say, hey, don't you have something else? I'm not really interested in surgery. I don't like the ibuprofens and Tylenol products. Isn't there something else? And to be honest with you, I didn't know. It was, people always know about glucosamine, and we all know the data on glucosamine and chondroitin. And, arnica is a very common homeopathic anti-inflammatory, anti-swelling agent. So most people have heard about it. But beyond that, my knowledge was actually quite limited. So these people were great because they were really interested. They're close to our hospital, and they were really interested in sitting down. And they said that they have worked with other doctors in the area in different, arenas or specialties. But they were great because they gave me a list of different options for pre-surgery, for arthritis, for post-surgery, for swelling, for nausea, sleeping issues, because so many patients have issues with sleeping. So now I have this nice little list that I can give to the patients that are interested in saying, hey, don't you have something in a more naturopathic sense that I could potentially use? And, the science is definitely different than the general science literature and data on medications and surgery. but there is, some data that I'm able to use there as a bibliography and say, hey, here's just some options, and here's a resource. These are things that you can try. And the other thing, we do lots of injections that you can tell somebody the instructions, but again, they walk out the door and they forget all that stuff, or they call your nurse back when they get home. I forget what the doctor told me. Can I exercise today or tomorrow? Am I supposed to ice it? So having a little sheet that says, here, these are the instructions for after your injection, they walk out the door with it. Again, a prescription for physical therapy is something that's easy. If you're setting them up for surgery, that's something that's easy. That's very sort of meaningful. They have this thing that they can tell their friend or significant others, this is what the doctor did for me. But otherwise, if you're giving them information and a plan, give them something in writing in a handout. This way they walk out with a plan, something in their hand that they're holding on to that means that they got something out of that appointment. And to save yourself time is those things that you do on a regular basis, write all those things down. I even have those on the website. So even if you're interested, you can actually go to my website and you can see what I've done. Feel free to grab it, and modify it to your liking for when you're in practice. But that becomes a good starting point of information that you can give and share with your patients, so you make sure that they're getting better, but they're leaving with the knowledge that you gave them that day in the office. So just great practice builders, a great way to, work on taking care of your patients and creating that patient rapport. And it's going to carry over because they're going to tell their friends, which is going to send more patients to you and really help build your practice, especially when you're just starting out. So thanks again for listening. I'm Adam Rosen. In the meantime, stay safe. If you like what you're hearing, please rate and review. It does help other people find this podcast. And until next time, you've been listening to the Total Knee Tips and Pearls podcast. You've been listening to the Total Knee Tips and Pearls podcast. Make sure that you're subscribed so you'll be notified of future episodes. And please take the time to leave a review. It helps other people like you find the show. Until next time, stay safe.